What if your body was sending you small warning signs long before diabetes ever showed up on a blood test? Most people miss them completely, and many are easy to confuse with just getting older. Today, I'll show you the 10 early signs of type 2 diabetes that you should never ignore, especially after 55, and what to do using safe, evidence-based steps. I'm Dr. Deepa, a retired physician with over 30 years in practice. I'll make this simple, clear, and practical. I also live with type 2 diabetes myself, and later in this video, I'll share how I was able to bring my numbers down into the pre-diabetic range. And no, I didn't involve giving up every food I enjoy. So type 2 diabetes doesn't appear overnight. It develops slowly, often silently, for years, but the body does whisper. When you know what to look for, you can catch it early, long before long-term damage begins. Everything I share today is based on reputable medical guidance, not the magic pill hype. A quick reminder though, this video isn't a medical consultation. I can't diagnose you through a screen. Well, not yet. Always speak with your doctor or healthcare professional for personalized advice. Let's dive in. Sign number 1 is increased thirst. This sign is usually the first thing people notice, but they often just ignore it. When blood sugar is high, your kidneys try to remove the extra glucose by pulling more water from your body. You become dehydrated, even if you feel like you've been drinking plenty. If you find yourself thinking, why am I thirsty all the time, especially at night, this is worth mentioning to your doctor. Sign number 2 is frequent urination. Thirst and urination travel as a pair. Many people describe needing to wake up several times at night to urinate, even if they've stopped drinking early in the evening. This is called polyuria, but in plain English, your kidneys are working overtime. If this is new for you, don't brush it off as age. It's a red flag. Fatigue that doesn't make sense is another one. If you watch my videos, you'll know that this can be a sign of another serious condition. Here's the video to watch on this after you finish with this one. I'll link it to the description box below as well. Your body's cells rely on glucose for energy. In early diabetes, glucose stays in the bloodstream instead of entering the cells. The result? A deep, persistent tiredness, not fixed by sleep, rest, or caffeine. Many people say, I feel flat, or I just can't get going. If that sounds familiar, it's worth checking. The next one is blurred vision. High blood sugar changes the shape and fluid balance of the lens in your eye, affecting how well it can focus. This isn't permanent eye damage yet, but it is an early warning sign. If your reading glasses seem to have stopped working suddenly, or your vision comes and goes, please don't ignore it. Slow healing of cuts or sores is another common sign as well. High glucose affects circulation and the ability of white blood cells to do their job. A simple scratch may take ages to heal, bruises linger, small wounds stay open longer than usual. If you've noticed your skin isn't recovering the way it used to, this can be an early sign of insulin resistance. Tingling, numbness, or burning in your hands or feet, also known as peripheral neuropathy, is the next one on the list. In type 2 diabetes, high blood sugar irritates and damages nerves over time. But here's the surprising part. Nerve symptoms can appear before you're officially diagnosed. If you feel pins and needles, numb toes, or burning feet, especially at night, speak with your doctor about it. One of the most specific early signs is dark, velvety patches of skin. It's called acanthosis nigricans, and it looks like darker, slightly thickened skin, usually around the neck, armpits, and groin. This sign is strongly linked with insulin resistance. It's not dangerous on its own, but it's a loud, clear whisper from your body that something is changing. Another sign that might be shared between several conditions is unexplained weight loss. Yes, weight loss, not gain. When the body can't use glucose properly, it begins breaking down fat and muscle for energy. This isn't the healthy kind of weight loss that happens quickly and without trying. If clothes suddenly feel loose without a change in diet or exercise, get checked. And also watch this video on when weight loss shouldn't be ignored. The link is in the description box below. This next sign is often misunderstood, and this is increased hunger. Here's the strange part. Even with high blood sugar, the cells are starving. They're not receiving glucose. Your brain responds by saying, eat more. People often describe feeling hungry soon after a regular meal. If this is new for you, it may be an early sign of impaired glucose tolerance. And the last one is more frequent infections. High sugar weakens the immune system. Common early infections include skin infections, recurrent urinary tract infections, yeast infections, especially in women, oral thrush. If infections keep returning, please don't just treat them and move on. This pattern tells a bigger story. Before we move on, I'd love to hear from you. Have you noticed any of these signs, or did something here surprise you? Share your experience in the comments so others can learn too. Why these signs matter? It's pretty simple. Catching these signs early gives you a huge advantage. And before we continue, I want to share something personal. I live with type 2 diabetes myself. A few years ago, my numbers were heading in the wrong direction, but with simple, steady lifestyle changes, nothing extreme, I was able to bring them down into the pre-diabetic range. I'll tell you exactly what I did toward the end of this video, but research from all major Western health systems shows that early detection and early lifestyle changes can delay or even prevent type 2 diabetes in many people. Let's talk about what to do next. But before we move on, please like this video and subscribe to my channel if you found this helpful. Also, don't forget to share it with someone you care about. It may help them catch diabetes early too. So, what should you do if these signs sound familiar? Don't panic. This is all manageable and you're not alone. Step 1. Talk to your doctor. The most reliable tests recommended in New Zealand, Australia, the US, the UK, and Canada include HbA1c, which shows your average blood sugar over 2 to 3 months, a fasting glucose test, oral glucose tolerance test, OGTT, used in some countries when other tests are borderline. These are safe, widely available, and medically validated. Step 2. Know your risk factors. The following raise your risk significantly. Age over 55. Family history of diabetes. Being overweight, especially carrying weight around the waist. High blood pressure. High cholesterol. History of gestational diabetes. And certain ethnic backgrounds, including South Asian, Maori Pacifica, African, Hispanic, Latino. If several apply to you, screening is even more important. Step 3. Practical changes that help. Across all Western guidelines, the strongest evidence supports eating more whole foods, vegetables, legumes, and whole grains. Cutting back on sugary drinks and refined carbohydrates, staying physically active, maintaining a healthy waist size, getting enough sleep, stopping smoking. These aren't dramatic changes. They're small, steady steps, and they absolutely work. Let me tell you briefly what that looked like for me. I didn't go on any extreme diet or spend hours in the gym. I started with simple changes I could stick to. I cut out sugary drinks completely and kept sweet foods for rare treats. I made my main meals smaller, especially the bread, rice, and potatoes, and added more vegetables and beans to my plate. I also began walking most days of the week. Nothing heroic, just 30 minutes at a comfortable pace. Over time, I lost some weight around my waist. My blood pressure improved, and my blood test slowly shifted from the diabetic range into the pre-diabetic range. That was over many months, not weeks, and I did it together with my GP, who adjusted my medications as we went along. Your plan may look very different, but I want you to know that small, steady changes really do add up. When to seek urgent help? If you notice severe thirst, vomiting, confusion, a deep, rapid breathing, fruity-smelling breath, please seek urgent medical attention. These can be signs of dangerously high blood glucose. This doesn't happen often, but when it does, it needs fast care. The sooner type 2 diabetes is found, the easier it is to manage, and in many cases prevent complications completely. Your body is talking to you. If any of these early signs sound familiar, please don't wait. A simple blood test can give you clear answers. Before you go, here are a few videos I recommend next. Thank you for watching. I'm Dr. Deepa, and see you in the next video.